Junior doctors in England are set to go on strike for 5 days next month, from 27th of June to the 2nd of July. So it's going to take place right at the climax of the general election campaign. The strike is over an ongoing pay dispute, but ministers are really upset. They called it a cynical move to actually get attention during the election. And let's just have a look, because obviously we've been used to this idea that, you know, the doctors have been really front and centre with their placards in the last year or two with their pay dispute. And we've been very much used to seeing their slogans, seeing what they're saying, seeing and hearing the debate. But during an election, things are different, right? So they get knocked back and the party leaders come forward. And obviously, if you're the doctors, you're thinking, wait, we really want to be front and centre again. So they push their dispute to the front of things, and that's where we are with it. OK, and fundamentally, it's about this percentage here. 35% is what they say they want to restore their pay to the level it should have been. But they've unfortunately, they say, had 15 years of below inflation pay rises. Junior doctors did get a pay rise, averaging nearly 9% in the last financial year. But the BMA walked out of talks last year because the government said we can only give you another 3%. And that was inflammatory to the BMA. They didn't want the 3%. And they said in the run-up to the election, there was a final opportunity to make an offer and avoid strikes that the government had, and the government didn't do what it was supposed to do. Here's the health minister tweeting, "I'm in politics to help patients, not trade unions. Today should be the Labour Party, the day that the Labour Party finally condemned the strikes. Announcing strikes during an election on Labour's Health Day shows this was only ever political and not about patients or staff." So she's cross with them, they're cross with her, and in the middle of things is Keir Starmer, who actually was quite condemning of the strikes and saying it's shocking it's not been resolved, but he doesn't want the strikes to go ahead. That's probably about as tough as he can be on the issue of striking doctors. Carrie, what do you think?
Fundamentally, I agree with strikes. So I think it's the way to protest. It's the way to get your point across without being violent. So it's non-violent resistance. It's a way of resisting. It's a way of getting your voice heard. I think in this situation, it is super difficult because people's lives are at risk. But let's not pretend that people's lives aren't at risk every day in the NHS because the system is broken.
But it's not just lives, is it? It's some poor pensioner who's been waiting for a year and a half for a new hip, and then they got to wait another 8 months now.
So put more money into the NHS.
What do you think, Angela?
I don't think, respectfully, I don't think putting more money into the NHS helps. The NHS is like a black hole and we've treated it like a religion for too long. There are critical organisational issues. I've got immediate members of my family work in the NHS, and what they tell me about some basic, really stupid situations whereby if this was a commercial enterprise, it would have gone out of business a long time ago. So that's the first thing. I agree that doctors need to be paid more. It's absolutely shocking what a junior doctor is paid compared to some of his or her contemporaries, given the years of study and the responsibility that is involved in that position. I've seen it front and centre, in my own family. But what I would say is this, is that I cannot condone the strike. I think actually it should be illegal for doctors like the police and the army to strike. They are a critical service in this country, and the hapless member of the public, we are held to ransom and almost blackmailed by their demands. I think 35% is a ridiculous number. Yes, I know you can say, well, what is the right number? And
well, they've never really shifted off 35. I mean, I thought it was a negotiating ploy. I'm not sure that it is
now,
they're not.
Actually.
I think it's is that a serious suggestion, 35%, Carrie?
We have to remember it's a pay restoration, not a pay rise.
Well, that's what you say. I mean, for most of that, a lot of that period, inflation was virtually nil.
So what about the fact that, each year there are between 8,000 and 9,000 newly qualified doctors? We lose 5,000 doctors prematurely, which costs the system 2.4 billion.
Because
that pay rise is only 2 billion.
Yeah.
So why aren't we retaining doctors? Why are they going elsewhere?
You can answer because they're in your family. I mean,
Yes.
the impression I get is the stress is incredible.
The stress is massive. I mean, you know, one of my kids is a junior doctor, full disclosure, but I can't comment on their views because they're not here. So I have seen it firsthand. And what I've also learned is, again, organisationally, you talk about losing doctors. When they apply for their advanced specialist training, which is when they want to become consultants in particular areas, there is this horrendous bottleneck whereby you have doctors who are 6 or 7 years qualified and there aren't enough of these advanced training posts. And that's when we start losing doctors. Now, that's ridiculous. So if you've got a whole bunch of doctors who are all perfectly capable of specialising in anaesthesia or paediatrics and the posts aren't there.
That is the same in all organisations. As you get higher up, there are fewer places to get promoted to. That's the whole point,
but
right?
it's not about promotion. In terms of a doctor, it's a very kind of... the trajectory is very clear. The more experience you accrue, the more you go up the ladder in order to be able to give more to your patients. So there are a lot of massive organisational flaws. And the other thing I would say very quickly is this is clearly tactical, as we know, by the doctors' strike in terms of the timing. They are absolutely committed to bringing down the Conservative
that is the
government.
question really for us today, is whether or not you support it, this is very bad timing. It's wrong to do it in an election campaign.
I think that when it comes to campaigning, you take those moments. Those are the critical moments for getting change happen. That's the time to get your voice heard. And again, with all due respect to junior doctors who might still be living at home, if you're trying to pay a mortgage and suddenly you can't pay your mortgage, but you're still working those crazy hours that junior doctors work, how are you meant to make that work? The sums don't add up.
Let's talk to Chris in Manchester. Chris, is it wrong to go on strike like this during a general election campaign?
I think it's wrong all the time, but just, well, I mean, I probably won't get very long, Jeremy, because you've got other callers. But just to pick up on something Angela said, there are insolvency laws in this country. The NHS has been insolvent for years. For Carrie to say just chuck more money at it, I'm sorry, it's ridiculous. What we need one of the big four accountancy practices to go in and audit from top to bottom where the money's spent, how it's spent, and give it to the frontline workers. The people
Well, hang on, you're going to end up paying loads of money to consultants to do that. They probably got them in anyway. Well, you just think it's all to do with having too many managers? Is that what you think?
Well, but if I can, very quickly, Jeremy, I used to be in the financial services sector. I had a client 20 years ago. She was married to an architect, and the architect was a client of the practice. She was being paid 65,000 quid a year. Then she was a nurse, and she didn't nurse anything or anybody. She managed 6 people. And she said to me, it's ridiculous. That's 20 years ago.
Yeah, okay.
So the money's wasted for me. Let's get in there, audit it, and sort it out.
Well, maybe it just needs to go. Maybe it just needs to go completely local, where you just say every county has its own hospitals, have their own budget. No, you know. But then you don't have a specialist centre anywhere. You don't have one hospital in the country that deals with one illness that only 20 people have. You
need centres of excellence for things like stroke, cancer, etc. Yeah. And Chris, I agree with Chris, but I would sort of extend that point by saying, yeah, bring the auditors in, but you know your big four are going to cost a fortune. Bring the clinicians in. They are the ones where they're saying, you know what, we've all been given iPads, but we've not been given chargers, or we've not. That's not true. I've just used it as an example. Or there isn't enough paper in the printer, or you know we're on 2 different sites managing one patient. Let the clinicians will tell you what's going on.
Yes, but it may be. But it's like saying in a broadcasting organisation to get the presenters to run it. Now, you know, okay, so...
run it to advise, but you can give a far better informed view than some manager in saying...
If I took over this place, it would be chaos.
No, but you can say... Nobody's asking you to take over, but they can canvass your opinion and say, Jeremy...
Work.
But, you know, does... So use the stairs, your legs are long enough.
But I mean, it's just that the clinicians taking over the health service is the same as the broadcasters taking over ITV.
You do need lived experience. Those people, that's not the same as
we
being
always
a presenter.
Say that.
A doctor is someone who is highly skilled in terms of what they are doing, and they're saving lives. So, and they've trained for many, many years to do what they do. I think, though, I'm sure they do interact. Why are we saying they don't interact? Of course they interact. But we do need to empower the workforce. The workforce is not empowered.
Okay, so interesting. So it's all about the strike, this. So whether it's right to go on strike in the general election campaign, and whether actually, you know, the doctors, the government sort of tried to park them and they're not having it. And maybe you say they've got every right to kick up. Now, more calls on whether you've had enough of the doctors' strikes. Rodney in Bedfordshire, hi.
Good morning, Jeremy, and good morning, panel.
Hi, so what do you think, Rodney?
Well, I think it's despicable them keep going on strike. They're holding the country to ransom. I'm not against them earning a good wage, don't get me wrong. But there's strike after strike after strike. Some of them are earning good money. They're earning extra money. They're doing other jobs. Look at the doctors you get on television. How much are they earning? They're on adverts on television.
Rodney,
Sorry?
come on. There's not very... A, probably not very much, but B, there's not very many of them, I don't think.
No.
So,
well, I don't know. There was 2 on ITV this morning on one show.
yeah, but you can't say we can't give doctors a pay rise because we've seen someone on television. That's not going to work, Rodney.
They're not junior
but
doctors.
you're not getting my point, Jeremy. I'm not saying that. What I'm saying is they're earning extra money. They're not.
Are they earning
by the
extra?
one job.
I'm not sure because my impression is they get run off their feet.
Crazy.
Angela,
I don't
But they're
know
not
where
run
they
off
would
their
have the
feet on
time to.
ITV, are they?
don't keep saying it. That's not an argument because they're not junior doctors.
my
Those
opinion,
ones,
you've
like
got
so
yours.
my friend and colleague Sarah Jarvis, for example, she's a GP of 40 years' experience. There's a different thing. So I don't know whether you can leave out the TV work, Angela, but could you, as a junior doctor, find time to work privately, for example?
I think they can do locum work, but
Right.
it's all about time and exhaustion, isn't it?
I think one of the points they're trying to bring up is the fact that so many of those junior doctors are heading for burnout, and that is a risk to patients. So that's a care for the patient, the hours that they're working.
Yeah, but paying someone more doesn't stop them having burnout.
Yeah, it's not. It's the way. It's the conditions in which they work. It's not about the money. They need to be rewarded for the hours of study and the training, but it's the conditions in which they work as well.
OK, Rodney, thank you for that entertaining argument. Roy in the West Midlands. Hi, Roy.
Hello. Yeah.
Wrong to strike in an election campaign.
No, it's wrong for the government to have let it go on this long, without sorting it out. Because everybody gets confused about the unions taking them out on strike. The union is the workforce. The union can't just say to everybody we're going out on strike. There's got to be balance. It has to go back to the workforce. So it's the doctors who...
Do you think they're trying to bring down the government, which is what the government says?
No, because they could have done that any time, and the government could have sorted it out any time.
Let me ask you a question, Roy. One of the things that kicked off all this industrial action, and it's not just NHS, it's train drivers and everyone else, was when inflation went crazy after Russia invaded Ukraine and it was up at 11%. It's now down at 2.5%. So surely the pay claim needs to be revised downwards.
Yeah.
But
We are
how
still
much
paying
has not gone down?
excessive money for groceries, petrol, and everything else.
Yeah.
OK, no, fair.
When
You
you talk about
so
inflation coming down,
prices are stuck where
when
they
I'm
were.
going to the shop with my pension, I'm still spending the same kind of money I did last month.
Absolutely.
All right, fair point, Roy. Of course, because prices aren't coming down. Inflation is coming down, which
People
is...
are still paying crazy high rents and crazy mortgage repayments.
OK. I'm always very struck when I talk to people in their 20s, whether they're doctors or not. They do not think they will ever buy a house.
It's true.
I mean, they cannot see how they will ever do it. Roy, thank you so much, my friend. David Newcastle, what do you think about this strike?
Morning, everyone. I think it's pure stress on the work. As you know, the workload is absolutely high. The burnout rate is really, really high for doctors. I think it's the same for a lot of public sector services. But the government force workers into a position because they put in anti-trade union legislation. I mean, the latest is minimum service levels. So effectively, the government have said, I will set a minimum service level, which is higher than the daily numbers that you have in place to carry out the workload. So it's just pure frustration for workers. I don't think any doctor wants to go on strike, but they're doing it for the benefit of the patients.
It's interesting that the minimum service level law hasn't worked yet because the train strikes went ahead despite it. Because when the train companies said, right, we're going to enact this law in the trains, they called it another 5 days of strikes.
Yeah,
So-
it's
so-
entirely counterproductive.
Yeah, it just didn't work at all. Thank you, Dave, very much indeed. I wonder what Labour will do if Labour win power. So they're going to have the same issue here. They sit down with them. If you were Labour, if you were West Streeting, what do you say?
What we do know is that in 2010, those waiting lists were right down. And for people like myself, I've got Crohn's disease, so a chronic long-term condition, you can be waiting months, and therefore you end up in a critical condition. You end up in crisis, and then people like me shouldn't be needing to access
But we
hospitals
say
all the
2010.
time.
I mean, 2010, the economy was in a state of utter devastation.
I don't know the last time any of you guys went to A&E or went into a hospital. It is a totally different experience.
Sure.
To how it was. We have to say, why is this happening?
So we shouldn't have had austerity. We shouldn't have kept spending.
There's also an issue here that people, because people can't get GP appointments, a lot of GPs have gone online. They can't actually physically see somebody when they want to. They're treating the local A&E as somewhere to go because they can't see a GP. You know, again, from listening to my own son, you know, people will go in on a Monday morning and say, I've got backache. And they'll say, well, how long have you had it for? I've had it for 6 months. But, you know, and they're using A&E as a drop-in point.
Yes.
But I come back. So I did ask a question, which is, if you're Labour and you sit down with them, what do you offer them?
The whole system needs an.
Come on. What do you offer them?
Like the amount,
18%.
I think it's about looking at the system. You have to look at
money.
All the privatised parts of the healthcare system as well.
Yeah,
the money that
I don't know, you just won't answer the question. I'm just saying that in the end, they're going to have to offer about 20%.
And it's going to be uncosted. And Rachel Reeves, who's busy saying, I'm not going to have any policy, I can't do the accent, without costing it, you know, then where is the money going to come from?
I just don't see how you can end the strike without offering them something like 20%.
Yeah.
Ali in Stockport, hi.
Hello, good morning, Jeremy. Thank you very much for having me.
Not at all. What do you think?
What I want is so simple. The question to you guys on the panel is, who is important, a plumber, a joiner, or a nurse and a doctor? Which one would you prefer? Of course it's going to be doctors and nurses. They play with our lives. They go in their hands. They can save lives. A plumber can come another time.
Well, you won't let me answer the question. Is your house flooding? Because I'm not going to ring a doctor if my boiler's blowing up. So at certain times you need a plumber. I don't want our plumbers who watch this show.
I don't think you do, but who is most urgent? Why? You know, and then you get the salary they get. There's no comparison with these poor nurses that sometimes they even overtime.
But plumbers don't have pensions.
One thing I wanted to say, Jeremy. So I'm sorry interrupting you. One thing I wanted to say. I'm an old age pensioner.
Okay.
I've got a problem with my hand, and I had a big problem, and I've been going to physio. I've been in there about a few times. 5, 6 times. I go in there and sit down. Is a room that is allocated to this gentleman or a lady, whoever they are, and they've got all the facilities there. They ask me questions, sometimes 1 hour, sometimes half an hour. Then they give me a sheet.
Okay, we've only got a second. Go on. Yeah.
This is the waste of money and resources.
Oh, it's okay. No, I'm with you. I'm with you. Thank you, Ali. Thanks so much. Thanks for all your calls. My goodness, so much.